السلام عليكم.
بسم الله الرحمن الرحيم. نرحب بالدكتور رائد حجازي ونشكره على حضوره وتكبده مشقة السفر. الدكتور رائد حجازي يشغل الآن منصب نائب رئيس قسم الطوارئ في مركز الملك عبد العزيز الطبي، ورئيس قسم الإصابات والعناية الحرجة، ومدير طب الكوارث. فنتمنى من الدكتور أن يوضح لنا أكثر ويرشدنا أكثر عن طب الطوارئ وعن التخصصات المندرجة تحته. تفضل دكتور.
بسم الله الرحمن الرحيم، والحمد لله رب العالمين، الصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Good afternoon. It's a pleasure to be here with you today to talk about medicine. And it's nice to be home. I'm a graduate of King Abdulaziz King Abdulaziz University, so it's very nice to be back to King Abdulaziz. لاحظت معظم الشباب مشوا قد كده تكره الطوارئ يعني ولا ايش؟ طيب hopefully ان شاء الله after this discussion يعني we'll like ER more. Things we'll cover today, I will talk about medicine, what's in medicine, the history of medicine, the good and bad about ER, who should be an emergency physician, should I go for a local training or go to North America, what are the fellowships or subspecialty available for emergency physician, some useful emergency medicine organizations, and some useful journals for us. Okay, this is a definition of medicine developed by the International Federation of Emergency Medicine. As you can see, it's a very long definition, but just to make it simple and easy, emergency medicine is about providing acute care for trauma and non-trauma cases. What I mean by acute care is diagnostic and therapeutic intervention. Also, sometimes we need some education to the patient so we can prevent the incidence or the occurrence of those illnesses. Emergency medicine is not only about providing the care, it's also about developing a system for emergency management, whether it's within the organization or outside the organization. My goal today is to give you an overview about emergency medicine, the good and bad about the specialty, also to change the vision a lot of people have about emergency medicine being a disorganized, overcrowded space that is staffed by unqualified staff. All of us hear this common scenario like والله حقوا الطوارئ سهرونا نصور الليل كل حالة يحولوها علينا. طبعا this is a very common concept or common occurrence in our emergency departments. That's because we don't have the real structured emergency medicine in our country. Those are some pictures I took from King Abdulaziz Medical City, National Guard in Riyadh. And as you can see in the previous picture, this is one of the trauma resuscitation area, equipped with all the equipment to take care of patients. This is the hallway, again the hallway. And here you can see an ambulance, which is an integral part of emergency medicine, which is the pre-hospital care, which I will talk about a little bit in the next 5 minutes. Okay, we'll move to the history of emergency medicine. I'll start about the United States. Emergency medicine started in the early 70s. Why? Emergency medicine was the same as here in Saudi now. It was staffed by GPs or internists or general surgeons that moonlighted in the ER for the extra income. So there was no emergency physician who was interested in the specialty at that time. In 1968, they developed the American College of Emergency Physicians, which had tremendous impact in emergency medicine training. The first structured training program was in 1970, and then the specialty started progressing. Now they have 130 programs in the United States, which graduate about 1,000 physicians per year. What about us here in Saudi? In the 90s, emergency medicine wasn't existing in Saudi Arabia. Beginning of the 2000s, when we start to have more trainees coming back from North America, emergency medicine started to show up in Saudi. And the first program was started in 2000. We graduated 4 candidates in 2004. Now we have, I think, more than 56 residents in our training program. Last year, we established the Saudi Society of Emergency Medicine. So, in summary, emergency medicine in Saudi is taking off, but we're still in the runway. We have a long way to go. طيب, let's talk business now. What are the good things about emergency medicine? First of all, diversity. You know, when you walk in the ER, you walk into the emergency department, you didn't know what's going to come in. You know, whether it's an acute MI, multi-trauma patient, somebody with a sore throat. So you see all type of patient or all type of illnesses in the emergency department, which make it very interesting. Yani, there is no routine. You go in and you don't know what's coming in. It can be a simple case, it can be multi-trauma, and so on. So, you know, when you go in, you're always looking for something new. You're always learning in the emergency department. The second thing is procedure. In the ER, we do fairly good amount of procedure, you know, from suturing, fracture reduction, reducing dislocations, central lines, endotracheal intubation, and the extreme, which is ED thoracotomies. So you still use your hand in the emergency department more than some of the specialties. Challenge. Frequently in the ER, we face this scenario. A patient comes in by Red Crescent, unconscious, in severe respiratory distress. So what should we do next? Should we wait for the family to come in and take history? No. In the ER, we act. So immediately we start stabilizing his airway, making sure that the patient is stable. Then we go back and take history from the family or the friends or whoever come with the patient. So sometimes we act based on limited or no information in the emergency department. The fourth thing is acute cases. As I mentioned, you can see very acute cases in the ER. We call it, emergency physician is adrenaline junkies, you know, like, you know, the rush when you see a sick patient. And you treat him and you see the progress or the improvement in the patient condition. Lifestyle. طبعا people will say, well, ER is not a good lifestyle. Actually, I see it the opposite way. You know, most of the ER that have well-structured emergency department, we do between 14 to 16 shifts per month. So you have 14 shifts, 14 days off for the whole month. Again, you know when you're working, you know Saturday I'm doing an evening shift from 3 to 11 p.m. Once I leave the hospital, I have nothing to do with the hospital at that time. Even if somebody pays me, there is no urgency. There is no patient that you need to respond to. There is no inpatient, so your work is limited. So when you're off, you're off. On the other hand, when you're working the ER, you're working. Last thing is the market factor. There is huge demand for emergency medicine right now in Saudi Arabia. So, for me, as a graduate, what does that mean? Once I finish training, I can walk to any organization in any city in the kingdom, and I can find a good position. I can negotiate my salary and my benefits at that point, which is very important. This is a very short summary about the good things about ER. So what are the moral of this cartoon, as you can see here, that there is a lot of people waiting to enter the department. So there is increased demand for emergency medicine, and we need a lot of physicians to cover the need. As I mentioned, the lifestyle, we're a shift worker. We work days, evenings, nights, we work weekends, holidays. You know, sometimes you go to work when your family is going to sleep. You go to work when it's Eid prayer. So there is no limitation for the shifts. You know, you work all the time. And this is one of the areas that a lot of people critique emergency medicine. It's a shift worker. Also, there is some impact on the long term on the health status of an emergency physician. Because, you know, you disturb your circadian rhythm, shifting from night to days. Initially, when I started practicing, I used to say, like, you know, why people complain about the shifts change from night to days? But let me tell you, as you get older, it gets more difficult to switch from night to days and vice versa. So shift change is one of the major difficulties you face as an emergency physician. Other people will critique there is lack of continuity of care. Because in the ER, you see the patient, either you discharge him with a follow-up or you admit him. Then you lose all the follow-up or all the contact with the patient. you can see it from a different perspective. For me, I like to see the patient, treat him. If he improves, he go out. If he's still sick, I will admit him. I usually like to say to the patient when he's leaving the ER, I hope not to see you again. Why? Because, I don't want to see a sick patient again in my department. I hope that he will be healthy. So continuity of care can be both sides, For me, what I've done for the cases that I find really interesting, I keep following the patient while inpatient. So I contact my colleagues in the inpatient department and I ask them about that patient. Emergency department can be very hectic. You can walk into a shift, it's very quiet, suddenly you get a trauma. 5, 6 patients injured. At the same time, somebody can walk in with an acute MI. So it's unpredictable, uncontrolled. Anything can happen at any time. The fourth thing is respect. A lot of people will say, طباع الطوارئ ما لهم احترام، يقول لك والله هذا طبيب الطوارئ كلمني عليه وتعرف طباع طوارئ ما هم فاهمين شيء. فطبعا الكونسيبت هذا is present till now, unfortunately, in our country. طبعا which the same thing, when I talk to some of the physicians in North America, they have the same concept about the 80s and 70s, but it changed. Once you prove yourself and you prove your specialty, people will change the way they think. Unfortunately, it's still present in our country. I remember when I returned back, I used to get irritated from people saying, oh, you're a GP. No, I'm not a GP, I'm an emergency physician. Now, I don't care anymore. I educate them about emergency medicine. Burnout. A lot of people critique emergency medicine that emergency physician didn't last for a long time. And there is some literature saying that the half-life of the emergency physician is 15 years. This has changed. The half-life is more than 15 years. In the past, people were not trained to practice emergency medicine. They used emergency medicine because they're forced to do it. That's why the burnout rate was very high. Now it's different. Now it's a well-structured training program. People choose emergency medicine because they want to be an emergency physician. And there is some tactics or techniques you can learn to overcome the difficulties of emergency medicine. We talked about some of the good and bad things about emergency medicine. So who should be an emergency physician? So if you love to work up undifferentiated complaints, if you, as a medical student, enjoy the call from your senior resident or intern asking you to go to the ER to see the patient with abdominal pain or vomiting or fever, and you enjoy taking history and physical exam to find the cause, I think emergency medicine will be a place for you. Like to do procedure also. You're not afraid to make decisions on limited information, which is very important because commonly in the ER we make decisions on limited or no information at all. Like to see 5, 6 patients at the same time, multitasking, which is very common in the ER. In the ER we have time constraint, we have to see a large number of patients, so you need to multitask all those patients. You get bored easily. What I mean by bored easily, like you don't like to see the same patient every day, the same, complaint, like his sugar is uncontrolled today and tomorrow is uncontrolled. If you don't like that kind of practice, emergency medicine may be a place for you. Okay, all right. Just a couple of minutes. If you like teamwork, in the ER we work with our colleagues and we develop a team approach. If you enjoyed most of the medical school rotations, I think ER is a place for you. If you prefer a specialty that had a breadth of information than a depth of information, ER is for you. Short-term relationships with the patient. Don't mind being criticized. You don't mind working weekends, nights, or evenings. Some people, they feel like they want to be the expert in their specialty. If you don't mind that, ER is your specialty. If you can eat faster than average adult people, and if you can stay more than 12 hours without going to the bathroom, think about ER. I will leave it for question now. And yes, sir. It's a very important question, which was, can I go to ER directly, or do I need to do internal medicine, then go to ER? And which is better to do? Currently, in our program here in Saudi, you can go to ER after you finish medical school only. There is no internal medicine ER option. Abroad, you have what we call a combined program. You can do both emergency medicine and internal medicine together. So you do 3 years of internal medicine, then you do another 2 years of emergency medicine. طبعا, which is better to choose? If you ask me which you prefer, whether you do local training or training outside the country, especially for emergency medicine, at the current time, if you don't have any social or family commitment and you get a scholarship outside, I will highly advise you to go outside. You know, they have long-term experience more than us. I think it's a better way to go outside. Personally, I like ER pure, so I will go to ER again. It depends what you like. Yes, sir. Okay, another nice question with, you know, like about doing internal medicine within ER. It's being an advantage. So when you're fed up from ER after when you're 40 or 45, you can go back to internal medicine. You know, currently in Saudi, once you start in medicine, you will be involved in administration. So by the time you reach 40 or 45, you will notice that you're doing a lot of administration more than practice, because there is a lot of need to develop the system itself. So for the next 10, 15 years, I think you will have a position in the ER and position in administration of the emergency department. So don't be afraid for the next 10 to 15 years to do just pure emergency medicine.
السلام عليكم.
السلام عليكم.
حياتي الزهراني كينج خالد يونيفرسيتي هوسبيتال فروم الرياض. عفوا دكتور، بس من وجهة نظرك في الانترن شيب روتيشنز، الاي ار عندنا احنا في 5 أسابيع فقط. هل تعتقد انها هي كمية كافية اني انا اخذ على الاقل جزء من الاي ار، او انت تنصحنا نصيحة ثانية زيادة على ال 5 weeks؟ شكرا.
Well, I think as an internship, 5 weeks, I think it's enough. But the quantity doesn't matter. It's the quality of the training you do. So if you do proper 5 weeks in a well-established emergency department, I think it will be more than enough to give you a good idea about emergency medicine, to give you a good feel about emergency medicine. The main thing is the quality. If you choose a place that have a good, well-established emergency department, I think 5 weeks will be okay. Yes, sir.
سمحت دكتور، بالنسبة للستريس لايف بالاي ار والدراما اللي تكون عندكم، فهل هذه تأثر على حياة الدكتور من ناحية الراحة النفسية والأشياء هذه؟ والله من أكيوت ستيج بس أول ما يدخل الاي ار ثم يتعود تكون الأشياء هذه عنده بالنسبة له؟
ممكن تعيد ذا السؤال ما سمعتك؟
بالنسبة للستريس لايف اللي بالاي ار، أنا حضرت بس يومين بالاي ار وشفت من الدراما اللي ما شفتها بعمري كلها
نعم.
فهل هذه الدعوة بس اللهم في أول مرحلة الاي ار بحيث إن الواحد بعد يتعود يكون كستمايز على الوضع ولا يأثر على حياته؟
ER your practice as an emergency physician is there is some level of stress all the time. So you need to handle stress very well to be able to function as an emergency physician. So if you cannot handle stress well, I think my advice don't go to emergency medicine, because you will have some level of stress all the time. They are dealing with people's life. Somebody who's really sick dying in front of you, you need to make a decision. So, regardless how much you spend in the emergency department, a year or 5 or 10, you have some level of stress. But you develop techniques or modalities or way to handle it, and you live with it without affecting your life.
عفوا، صفات سنوسي جامعة أم القرى. عندي سؤالين. السؤال الأول، الاي ار سيوتبل للفيميل ولا لا؟ في رأيك الشخصي. السؤال الثاني، البروجرام حق الاي ار كم سنة؟
والله السؤال السيتبل for female, it's difficult for me because I'm a male. I cannot answer for you. But I think if you think about it, it's a very nice specialty because you have only 16 shifts a month, so you have 14 days off time. the other nice thing, when you're off the department, you're off. And once you finish your shift, you have nothing to link you with the hospital. So that can be an advantage. The disadvantage for a female is like working a night shift or an evening shift. This year, we graduated 2 female physicians from our program, and they are the first female to be graduated from our local program. And I think there is only one Saudi female trained physician here working in Jeddah. The length of the training is 4 years. So the program is total of 4 years.
دكتور وضاح أبو طالب جامعة أم القرى. I have 2 questions. The first one, if I started a program and due to the stressful life and the ER, and this will make problems with my family and such how, would I sacrifice my career over this, or?
Okay.
And the second question, due to the night and day shifts, how can I adapt myself to the night and day shifts?
All right. We're back to the stress issue. Some people see stress as an advantage in the medicine department because you keep you awake and alive all the time. You get this adrenaline rush all the time. طبعا الستريس في الإيار, if you don't know how to control it, if you don't have a technique to control it, it will get into your life. So that's why I would advise all the people who think about ER to do their elective rotation, get a feel about the medicine. Medicine is not for everyone. There is people who can handle it and people who can't handle it. So do an elective, see if you can survive the rest of your life doing this specialty. Don't choose it wallahi because this is the only option I have. Whatever you decide to do, make sure you enjoy it because you'll be doing it the rest of your life. The second question was about how can you adapt to the shift from night to days. There is few techniques. For example, before your night shift, if you can sleep 2 or 3 hours in the night, it will help you to maintain your circadian rhythm. Switching from days to night, it's the same thing. If you can sleep in a very dark room, it may help controlling your circadian rhythm. So there is few techniques you can use to help you to switch from days to nights. Last one. Well, a very good point that Dr. Sultan raised. In medicine physician, we call it محولاتي or referrologist. You come and see a patient with abdominal pain, you refer him to surgery. Somebody with chest pain, you refer him to cardiology. Somebody with headache, neurology. طبعا this is a very old concept. Established because there is no qualified emergency physician working in the emergency department. في الER, you refer about 7 or 8% of the patients you see, and most of those patients will require admission. So the concept of just referring patient, I think it's an old news. Now qualified emergency physician know how to treat, how to manage most of the cases, and when he calls a specialty, they need most of the time admission, or they need the follow-up as an outpatient.
دكتور بس آخر سؤال هنا دكتور باسل الخضراء جامعة الملك عبد العزيز سنة 5. دكتور الشخص اللي يتوظف في الإدارة ويكون يتوظف كتخصص هل أعصابه مثلا أفضل تكون هادية ولا تكون دمه زي حامي أو متفاعل كده أكتف ولا يكون هادي عشان يعرف يتصرف ولا يكون البرسوناليتي تبعته كيف أفضل تكون
Actually, you need combination of both. تحتاج الاثنين. إنك تكون هادي لدرجة إنك you can control your emotion. وفي الناحية الثانية إنك you can act. يكون عندك الجراءة إنك you can act. فيو need a balance between اللي هي calmness والattitude إنك you act in case of in real cases or emergency cases. فit's a balance between both. Thank you.
سماح.
إحنا
معليش نعتذر لأن الوقت انتهى لأن وقت الصلاة. ونشكر الدكتور رائد حجازي جزيل الشكر على قدومه من الرياض.